attend today, but I'm very happy to be here. I work very closely with John. We do federal and state advocacy for NSGC. So today is a little bit of a rundown of what we've been up to on the state and federal levels. Let's see. There we go. Okay, so we're going to start very quickly with an overview of the state licensure efforts. So NSGC works very closely with states to get licensure bills passed so that there are genetic counselor licensing. Right now we have 32 states who are issuing licenses. We have 3 in rulemaking and another 13 states that are somewhere in the process. So we have a little bit of an update of some of our bills that are in the process, and then we'll provide a little bit of an overview again of what it looks like to actually be in the thick of things. And I think some of you are probably familiar with this. So very quickly, we have an update on Texas. Our bill passed the House, as it has in previous years. It died in the Senate, but this year is a little bit of hope because we have a committee chair in the Senate who held up our bill a number of times. That committee chair has moved committees. We don't anticipate that opposition staying, so we do believe that when this is reintroduced in 2025, that we will have a clear pathway in the Senate. And so we anticipate this passing in the House and the Senate. It died this year in the Senate, not because of opposition, but because they just ran out of time to consider it. So Texas is one of those states that meets every 2 years, so we'll see this come up again in 2025. Similarly, in New York, we had a bill passed in the Senate, as we've had many years, and then an assemblywoman who chaired one of the committees went out of her way to oppose this bill for 10 years in a row. So she has switched committees, and we anticipate that there will be a clear pathway for us in the House when this comes up in the next session for New York. And then here in South Carolina, we actually have a bill that's passed in the Senate. It has stalled in the House, but the good news is that we can pick up where we left off in the next legislature and actually take that bill that passed in the Senate and work on it in the House. So we anticipate that moving steadily as well. And then in North Carolina, we are in negotiation modes with the Medical Board and Medical Society, and that's making progress. We anticipate an introduction of that bill sometime in 2024. And then legislative sessions for the states are all over the place. You have 50 states with 50 different schedules. They typically meet in the first quarter or first few months of a year, and then they adjourn. So that legislative window is very narrow, but it's very intense. And so we are right now working and getting our ducks in the row for work on the 2024 sessions. So we have Arizona, Maine, and West Virginia who are all active right now with bills, and we anticipate those moving early next year. And then Mississippi is a focus. And so if you are from Mississippi and you would like to get involved, please contact us. We can't do this without you. We provide guidance, resources from you from the headquarters in NSGC, but we actually need feet on the ground and genetic counselors to help us with this. And so it's very important to have your involvement. All right. Now I'm going to move to the federal effort. So we have a bill in Congress called the Access to Genetic Counselor Services Act. We've had this bill in a number of Congresses. What this would do would authorize the Medicare program to recognize genetic counselors as providers. So right now, Medicare recognizes the genetic counseling service. It cannot allow genetic counselors to provide that service. And so why that is because Medicare has the authority to expand services at any time. They don't have the authority to add providers. That has to go through Congress. And so we actually have to put a bill through just to authorize that recognition. So the Access to Genetic Counselor Services Act is that bill. What it would do is it would authorize that Medicare status for genetic counselors, and that would allow you to directly bill Medicare. It would also allow you to directly see Medicare beneficiaries without the supervision of a physician. So right now, to see a Medicare beneficiary, you have to actually be supervised by a physician. You bill through that physician, incident to billing. There's a lot of barriers. It creates a lot of access barriers, as you know. This bill would lift all of those. And so as your state practice acts look like, you're able to practice independently. For Medicare, that would be the case here if this bill passes. We like to really talk about this bill in 3 buckets: cost, quality, and access. First off, with access, of course, is that right now, Medicare beneficiaries have to jump through a lot of hoops to see you. You have to be supervised by a physician. If there's not a physician on site, you can't see that patient. If you have a full slate of patients for that day and the physician calls in sick, you got to cancel all those patients. It runs on. And it's an artificial barrier is what we call it. And it's only there because of the way policy is written. The authority, CMS just doesn't have the authority to recognize you as providers. So again, this bill going through Congress, which is a very tedious process, is just what we're all waiting on. And of course, the access to your services, just like any other patient, a Medicare beneficiary can just walk into your office, call you up, and schedule an appointment. They don't need a referral from a physician, and so that supervision bit and that extra hurdle is taken away with this bill. And then in terms of costs, which is a hot topic on Capitol Hill, is that genetic counselors' involvement leads to more appropriate utilization. The genetic testing bit, the skyrocketing costs from the inappropriate utilization is pretty well known. We know we have data showing that when genetic counselors are involved in the counseling process and the test ordering, that that utilization it goes down. You're ordering for the right person, the right test, et cetera. And then, of course, better health outcomes. When you have more access to patients, you're able to pinpoint who in that family needs tested, et cetera. That's going to lead to early detection, early prevention, a lot more awareness, and so those outcomes are better. And then the big thing is telehealth. So telehealth with genetic counseling was a big thing before COVID. It's very conducive to to telehealth. You don't need to perform a physical exam, so this is something that genetic counselors have been doing for a long time. Of course, with the way things are written, you can't do this for Medicare beneficiaries. Now that the public health emergency is lifted, this bill would allow you to do that. And so probably one of the populations that would most benefit from telehealth, Medicare beneficiaries can actually do that with your services right now. Going in a little bit more into that access piece. So again, we have that supervision piece. We also have the need for physician referral in many cases. And so if a physician wants to refer a patient to a genetic counselor and doesn't have an established business relationship with a genetic counselor, they have to refer that patient to another physician. That physician has to establish that patient before that patient can see the genetic counselor who works with that physician. And so if you're physician number one, you're basically referring your patient to another physician. You're not sure if that patient's going to come back to you. And so there's a little bit of a access blockage there with those referrals, simply for that reason. So if that physician number one may just opt to provide genetic counseling himself rather than that referral. And so that referral flow you'd see a huge increase in referrals if you were able to remove the supervision clause and allow genetic counselors to see a patient directly without physicians involved. And then, of course, you have the billing incident 2. So if you see Medicare beneficiaries, the supervising physician bills on your behalf, bills at 100% of that physician fee schedule. Genetic counselors, the way the bill is written, would bill at 85% of that physician fee schedule. So we're looking at 15% cost savings right there. That's a very good point to bring up in Congress. It's very important to help get this bill passed. Okay, so quick update exactly where we are today. We have a bill in the House of Representatives. Our bill champions are Representative Adrian Smith, a Republican from Nebraska, and Brian Higgins, a Democrat from New York, both of whom are on the House Ways and Means Committee. That committee has jurisdiction over Medicare policy. The other committee that has jurisdiction is Energy and Commerce. Our strategic pathway here is to get much support from Democrats and Republicans from both of those committees on this bill. Our House bill was introduced June 6, 2023, and we introduced with, should be 14 original co-sponsors. They're listed here. Again, 7 Republicans, 7 Democrats. We want to keep this bill balanced. This isn't a political bill, it shouldn't be. We want to show that by just keeping the Republican-Democrat balance growing steadily at the same rate. We have had 5 additional co-sponsors since introduction, totaling 19. So it's been introduced for about 6 weeks now, 19 co-sponsors. We would really like to see that grow, and we're working hard to get that number up. You see a couple of names here that are bolded. Those are members of Ways and Means, and those who are italicized are members of Energy and Commerce. So we have a good representation already from those key committees. We intend to introduce a Senate counterpart as well. Our Senate champions are John Barrasso, Republican from Wyoming, and John Tester, a Democrat from Montana. John Barrasso is a member of Senate Finance Committee. That committee is the Senate committee that has jurisdiction over Medicare. Introduction is imminent. We expect it almost any day now, so we will get the word out when that happens. We introduced this bill in the inaugural 117th Congress, which was 2021 and 2022, secured 7 co-sponsors. We do anticipate kind of starting where we left off, getting those 7 back on this bill and really working on that number. So recent activity is that we are following up with the co-sponsors from last Congress, both in the House and the Senate, getting them aware of this bill, getting them on this bill, and then we are doing a number of virtual meetings. So one good thing about COVID is that it really did change the way meetings are done on the Hill. So since before 2020, or from 2020 up until now even, all that was done was virtual meetings. January of 2023 was really the first time that you can just walk in to the Capitol and have a meeting without going through a lot of hoops. So while that in-person meeting is back and it's happening, the virtual meetings are still here, which is really great because it allows constituents to have those meetings to get them in front of their members of Congress without them traveling to Washington, D.C. And so the majority of our meetings that we do now are with the constituents, and we do them virtually. So what happens is that we have a sign-up process for genetic counselors. They, along with John Richardson, conduct these virtual meetings with congressional offices, and it's a really nice balance. You've got the lobbyist who can speak to the technicalities of the bill, but then you have the constituent who really does have the powerful, compelling story. You're talking about your patients, you're talking about what you're seeing because of these access barriers. You're talking about how, the impacts you have on patients, families, et cetera. That is all really helpful. It's a compelling story, but at the same time, you're able to localize the issue to that district, to the member of Congress's hometown, et cetera. It's very powerful. And of course, many of you are employed by hospitals, et cetera. Hospitals usually are the biggest employer within districts. Members of Congress pay attention to that. So we already have a very captive audience when we're talking about some of the things that we're talking about. Lobbyists can talk about it, but it really is better coming from all of you. So we are facilitating constituent virtual meetings. Right now we have about 100 genetic counselors who have signed up for meetings since we have introduced the bill. And I will go into a little bit of how that works here in a second. But we also have a coalition, and this is a series of organizations that publicly support our bill. They are hospitals, they are patient advocacy groups, they are other professional associations. They are supporting this bill. We have 450 listed currently, and we keep them updated with a quarterly newsletter for the coalition, but then as things come up, as things are introduced, we send out updates as well. It's a really good network of collaboration, the coalition. There's a lot of organizations that have bills out there. We help each other out. We support each other's bills, but we're also, a lot of them have lobbying teams that this is one of the bills that their lobbying teams are helping them with too. So it works very well, and the coalition is something that we rely on very much. So we can set ourselves up for success as much as we can by getting co-sponsors on this bill, getting a coalition up, but a lot of this is still left up to a very messy process, and that is what it takes for a bill to become a law. It's no way, shape, or form linear. It's not neat and tidy. It takes time, and some of it is just very much up to chance. A bill like ours, the Access Genetic Counselor Services Act, if you print it out, is maybe 2.5 pages, and that's large print. It's not going to ever get its own deliberation on the floor. What will happen is it'll get attached to a very large vehicle of legislation. And so there are always must-pass legislative vehicles, usually toward the end of the year, that Congress has to pass. Those bills are very expensive. What they do is they look for offsets for smaller bills that are cost savers to help pay for the bigger bill. So we are trying to gather data to present ourselves as a cost saver so that we are very attractive to these larger vehicles. One way we do that is that cost data. The other way we do that is to get as much co-sponsors, especially from those committees, the ones I mentioned, on this bill. And so when this comes up, you've got a lot of people who are already in that room who are supporting this bill. All right, so talking about more support for this bill, we work on quantity, which is just numbers. A little bit of history, we introduced this bill in 2018 at the end of the congressional session, just as a feeler. we had 2 co-sponsors. We introduced again in 2019 and 2020, totaling out 20 co-sponsors. We're a trajectory to have a lot more. We had a board fly-in with NSGC in late February of 2020, and then 3 weeks later, everything was shut down. So we weren't able to pass or introduce a Senate companion at that time. We just kind of focused on that House. Congress is still trying to figure out how to do the virtual meeting thing. So a little bit of stalling there, but we came back in 2021 and 2022, introduced our House bill, and obtained or secured 69 co-sponsors, House Republican Democrat, introduced the Senate bill, the companion, and that secured the 7 co-sponsors. At the same time, we're looking at quality. So 46% of those 69 co-sponsors were on either Energy of Commerce and Ways and Means, those committees of jurisdiction. And then the remaining 54% were just additional co-sponsors. So a really good balance of that committee representation. All right, so we do this all with your help. Constituent meetings are key. In the last congressional session, 2021 and 2022, we met with 150 congressional offices. 219 genetic counselors signed up for meetings and joined John Richardson for 115 of these meetings, all virtual. We met with 28 House meetings with those key districts, 12 with the Senate Finance Committee members. Capitol Counsel is a lobbying firm that we work with in Washington, D.C. They help us with some of the higher level meetings, congressional leadership, the committee leadership, and additional key offices. So they hold a series of meetings as well. Between January and October of 2022, we had 486 genetic counselors either meet with their members of Congress or write letters by email. We have a software platform that you can do it from the convenience of your smartphone. We had 350 supporting organizations as part of that coalition, and then that resulted in 35 of our 36 co-sponsors in that amount of time. And then right around the time of NSGC's annual conference last year, we did a very specific push. We got 3,006 genetic counselors to sign on to our constituent letter, urging their member of Congress to sign on to this letter to pass this bill. We sent 375 of those letters to representatives, and that's about 86 of all of the House of Representatives. And then on the Senate side, 98 out of the 100, missing only Alaska. So the response rate from all of you was fantastic. Every state was represented except Alaska. And then we had 254 organizations sign on to our year-end package request letter. That year-end package is one of those legislative vehicles we were trying to get on. And then you can see just the amount of engagement that we did last year, and just that very specific push in November. We got a tremendous response from everyone within the profession. A little bit more about that coalition. If you're interested to see who's in that coalition, if you go to this is the link, but if you go to NSGC's website, there's a on the front page there's a policy, research, publications, etc. Click on that, and then you'll see federal updates or federal legislation. It'll be under there if you want to see that full list. Just email me too if you want to see it. We had 200 organizations sign on to that coalition, which raised our numbers to 450. 65% of ASCO state chapters are on that list. We have a lot of rare disease colleagues and advocacy groups who we work very closely with. They are on that list. NCCN presentation has been very helpful to get more on that list. We've engaged hospitals, and then our year-end campaign, as I said, 254 organizations signed on to that letter in early November. Okay, going into costs a little bit. CBO is what we call a Congressional Budget Office. It's what Congress uses to kind of put a price tag on bills. We are gathering data to make the case for us being a cost saver. CBO will either make or break your bill. If you are deemed a cost bill, you will have a very hard time digging yourself out of that. If you're a cost saver, you will be very attractive to every member of Congress and to those large vehicles. CBO sometimes does what we call dynamic scoring, and that's considering down-term, long-stream cost savings, what a bill would do if you shift utilization or if fewer people become sick because of your bill 10 years down the road. Or they don't. Or they just say, this adds a provider, therefore it adds utilization, it'll cost money. We are gathering data to show that counter to that, when you add a genetic counselor, more appropriate testing happens, and that the test savings from appropriate testing is far greater than what a genetic counseling service, what Medicare would pay for genetic counseling services. That's a fact. We've got a lot of data on that to support that. As well, we have genetic counselors being paid at 85% of the physician fee schedule. That again is a 15% savings from what Medicare is paying out right now. Physicians who supervise genetic counselors can supervise as well as perform another procedure at the same time, so they can basically bill for 2 procedures at once. That's happening now. This bill obviously would just enable the genetic counselor to bill instead of the physician billing double that, or billing for 2 different procedures, and the genetic counselor billing at that 85% rate. We are working hard on this data. If you have access or if you know of any data that might be helpful to us, please let us know. We'd be happy to work with you on that and talk to you a little bit more about how that works. All right, our next steps. This bill, Congress right now, we have until December of 2024 to get this passed. We're working very hard to recruit co-sponsors to our House bill, and then when the Senate bill's introduced, the same thing on the Senate side. We're obviously looking on those committees of jurisdiction to get as much support on that as possible. We have a group of NSGC members called the Advocacy Coordinating Committee. These members are kind of like what we call regional champions. They just work on various regions in the United States. They help recruit genetic counselors, encourage them to sign up for meetings, encourage them to sign on to those letters, all those things. So they really help, and it's really nice because it's peer-to-peer work. It's not just the lobbyist telling you to go do something. It's your fellow genetic counselors helping or encouraging you to get involved. John and Capitol Council will continue to do in-person meetings in DC, but the recruitment that the ACC does is all for virtual meetings so that you can do this at your convenience. And of course, if you're in DC or live close by, we're happy to have you come in person too. So we anticipate that Senate bill introduction at any time. And then once we continue to get that support, we do anticipate a congressional hearing on this bill so that we're really able to get on the radar, but also see where we fit with those larger vehicles that'll probably hit later this year. A little bit more information about how you sign up. So we have a QR code. If you scan that with your phone, it'll take you to a quick registration list. We ask some very basic information, your name, your address, just so we know what congressional district you are. And then we ask for your basic availability so that we can schedule a congressional meeting around what works for you. So what happens is you sign up, you submit that list, we will contact you, schedule a meeting for you, we prep you, we provide you with talking points, documents, anything you need. You answer any questions, and then we accompany you to that meeting so that you're not alone at any point in this. John is on those meetings with you. If you want to meet with John beforehand, you're welcome to do that, and then you both do that meeting together. If you want to get in touch with the ACC committee, that's advocacy@nsgc.org, and they will be able to answer some questions to you as well. Quick highlights of the bill. Like we said, this bill is very straight and narrow. It doesn't do anything but authorizes that provider status for you all. It doesn't expand services. It doesn't touch billing, coding, or anything else. It just allows genetic counselors to provide services to Medicare beneficiaries. Allows your direct reimbursement. You don't have to do physician to or incident to a physician anymore, and that physician supervision is removed. So it more or less aligns with your practice acts that you're seeing on the state level. Improves patient access, and then we make a very good case for this being a cost-effective initiative, as well as because it will decrease healthcare spending at the get-go as well as downstream. And that's what we have. If there are questions, I'm happy to answer.